Hi, good afternoon. Thank you for coming to the Bite Size Booth Talk this afternoon. My name is Rob Leslie, Senior Director of Implementation here at Arcadia, and then my colleague.
Mike Tiffany, COO for Arcadia. Been in the healthcare industry for about 20 years in the customer service, client onboarding, and client operations areas.
Great. And today, the talk topic is making a good first impression, keys to achieving long-term success in healthcare data analytics. So as you can tell by my title, I lead up the implementation team here at Arcadia. And what we want to talk about are a couple things that are important to be thought about and implemented around the time of kickoff that are outside the concept of the core project implementation. So that's kind of the theme that we'll be talking about here. So achieving long-term success in a healthcare data analytics platform effort, such as adopting Arcadia Analytics or Arcadia's platform, is extremely, extremely difficult. And one of the things that we think is really important is initially starting off with the concept of having a partnership. So thinking beyond a standard vendor-client relationship that you might have leveraged in the past. So here are just 5 pillars of what that looks like, and just going to walk through them. So the first is aligned vision and partnership success metrics. So understanding the why of what a client is looking to accomplish from a goals perspective is important, and especially making sure it's clear and communicated effectively by a key executive stakeholder on the client side is really important. Next, thinking about strong partnership governance at the beginning of the project. Governance cannot be a conversation that starts post go live. It needs to be start at kickoff. You need to have a clear governance plan and clear ownership and accountability right at the beginning. My colleague Mike Tiffany will talk more about organizational-wide change management, but what I just want to say is having a focus on change management from the beginning is also incredibly important. An example is a lot of our clients have existing reports that they're using today, payer supply quality measures, payer supply gap reports, and they know that there's issues with them, and they know they want to move to a unified data model such as Arcadia for better analytics. However, it's very difficult to leave behind what you've been using for a long time, and just recognizing that there could be conflict there. It's not going to be as simple as just turning it on, and being aware for that and planning for that is incredibly important. Next, so an implementation focused on adoption and productivity, long-term adoption of the tool. So this is really anchoring the day-to-day implementation on the aligned vision and overall strategic goals of the implementation to ensure that long-term success. Lastly, this kind of goes into it, like having a defined client resources for long-term management. So ensuring, for example, as you transition from implementation to steady state, that you have the appropriate support resources defined for that long-term success, which could potentially mean hiring folks to be kind of new resources to manage this platform. So another thing that I want to talk about again that needs to be talked about right at the beginning of our relationship with Arcadia is driving organizational alignment. So you can hear it's kind of a play between strategy and action, and I'll stop at the top of the bottom. So the first thing is having a cross-functional leadership team that aligns on the business priorities and strategic intent of the partnership. So for anyone who's worked with me in the past, sometimes I think the word cross-functional is overused in the business and healthcare space in general, but this is a scenario where I think it's absolutely necessary. Arcadia's data analytics platform touches so many different functions of a health system or a payer organization, quality management, risk management, care management, provider organizations, managed care, IT, IS, security, and all those functions need to be represented in this leadership team so they have a voice. Next, that team needs to identify and clearly articulate the success factors, and then be able to communicate them down within their functions. And as we move to more action, again, setting clear ownership expectations across your organization to drive that accountability within each department, and then lastly, here at the top, all of these messages, all of these key strategic drivers that are defined, it's gonna be a lot better coming from someone that's not Arcadia, to be honest. A key and respected strategic executive or medical director or physician, they need to be able to evangelize this throughout the organization, and that's going to drive a lot more alignment and help manage potential bumps in the road over the course of the initial implementation. So I'm going to pause here and hand it over to my colleague.
Great, thanks, Rob. So over many years, I've taken to loving this slide and this picture of the Kubler-Ross curve. Often, people initially think of this as like a grief recovery curve, but it's often used for change management, and change is difficult. And so what we're showing here is the importance of change management and taking that on at the very beginning of a relationship, at the beginning of a project, so that you can manage the expectations of the organization and all the different individuals that will interact with the platform, with the service as you move forward. The key here is, if you look at the solid line, if a user comes into a project, into a new partnership, and is misaligned in expectations, and that can be many different things. They might expect too much from what they're going to be receiving, that it's going to address areas that it doesn't, or it might be that a provider doesn't believe they will be impacted at all. Either of those two things is going to lead to a very difficult transition for the organization and for the providers. And what you end up with is that heightened expectation of what this means to me, and ending up with a very, very deep, usually at around go live, what we'll call the depth of change fatigue. The bottom drops out for that particular user, for that provider. And that is a really long effort to pull them back out. Having that bad first impression of the system, of the partnership, can poison that implementation partnership early and lead to a lot of resources that have to be invested to try and get that person optimistic, back on that confidence slope again. If you then, via change management, the goal is to really just squish the curve. Everybody should know what this means to them. They should not feel like there's a system being implemented on them. They are part of an implementation. They are part of a change. The more invested they feel, the more educated they feel, the better you're going to have from a results perspective. There will still be those expectations. There will still be some disappointments in what things happen. But if you can control that via communication, via considering the different user personas that are going to have to touch the system, and thinking about how you communicate to each of those different user personas, those different areas of your organization, you will be on a much faster slope to acceptance and value out of the new service, out of the new partnership. So from a change management perspective, a few items. There's some important questions you have to ask yourselves as an organization. And the first one being, do we do this well? When's the last project, that big, impactful project for our organization, and how did we facilitate change management? How did it go? What were the wins and what were the learnings? Understanding where you're good at this and where you have deficits, and then asking, do we have someone with both the skills and the time to invest in a really large critical project? If the answer is yes, wonderful, you've got the start. If the answer is no, then you have to take a step back and say, I can't disinvest on the change management side. Instead, I have to make a decision of, am I bringing somebody in? Am I looking for an outside party that fits well with my organization to help drive this change, to ensure that successful adoption? But skipping that step is never a good decision at the beginning. So once you have a strategy, I'll focus on the left here to start. Communication, that communication plan. As Rob mentioned earlier, you want the key executive that really owns this program to be the person that is communicating the vision, how it impacts the organization. And you have to think about the modes of communication. Is it email? Is it town halls? Is it newsletters? What works best for the user bases that you're deploying to and the users that will be engaged in the system specifically? And making sure that you then have constant communication throughout the process. It can't be at the beginning and at the end. Make them feel, even if they aren't on the project teams, make them feel like they are along that implementation ride, that onboarding ride, so that they can see the changes, see the progress being made, and it will raise questions that can get answered during the process versus waiting until the end and having that misalignment. Second, expectation management. We somewhat covered this on the curve. Set guardrails. Get people excited for the project for the right reasons. There will be places that people maybe aren't as excited because they like current functionality. They're stuck in their ways in some cases. Know what those areas are going to be and focus on what the wins are in those areas, and be honest if it is going to have a pain period before you get the benefits of a particular change. Detractor management. Every organization knows who the squeaky wheels will be, who are going to have the hardest, the largest challenges with the change. Finding a few of those people and turning them into your champions by involving them in the project. If people within the organization know that that person is normally a detractor, it shows a lot, and it definitely helps to pull the organization along if that person can become a promoter of the project. And then sustainment. This is an ongoing project. This is an ongoing process. It leads into the right, which we won't cover, but it really shows that kind of continuous improvement cycle that you then go through for the rest of the time, using that, refining that program, but have the right resources in place, have the right metrics in place, have the right communication in place to show users the importance of the project and how you're continuing to invest in that area to facilitate success. And with that, any questions?
Thank you. Yeah, any questions? Well, I think a couple things there. So I think the graph probably stays the same. That's really about setting expectations up front around things like timeline, right? And being really clear and really clear about what might go into keep having something go from 6 months to 2 years. So we have examples of that from our Arcadia's past of that. And so I think that's the point of some of the things we're talking about around governance and thinking about the partnership approach, really governance. I was saying you need to have key engaged leadership and key decision makers up front and part of the project to be aware of those potential pitfalls and be able to quickly make decisions and adjust when we're slipping past what should be a 4 to 6 month period, and we're starting to see it being 1 to 2 years. So personally, I don't necessarily think the curve changes, but it just shows why it's so important to have engaged leadership and governance activated on day one. That's my 2 cents, unless you have.
Yeah, I mean, I think it gets to the importance of any given user persona knowing when they will be impacted by the system. And so you can see the curve looks similar for any user. You may see different users hit that trough of change fatigue at different times, but they're all going to go through the same curve. It just might be when they hit that curve and when it impacts them.
What happens if you don't do this on day one? What happens if you're on day 90 and 91 and 92 and you realize that you didn't do it or you didn't do it enough? Is everything lost, or do you have recommendations for how to crawl out at that point?
Everything's not lost. I would say at that point, though, you really want to make sure you create, like, let's say you're realizing, oh, we really don't have a governance and engaged leadership. How do you ensure that those conversations aren't just glorified status calls because you're 90 days in and there's issues? You need to tease out core project work, which it'll be ongoing. So like, what is potentially driving issues 90 days in? Is it resourcing on the client side, resourcing on Arcadia side, things like that. So that's sort of my answer. You can absolutely do it, but the hard part once you're kind of already in the project is people are they're at 5,000 feet when we sometimes need them to be at 50, and that's hard. I think it's really hard to do once you're kind of in and you've got issues. I don't know. That's my perspective.
Yeah, I mean, I think if this launch is too late, you're going to be dealing with some preconceived notions that you now have to overcome from the user base. And so it's going to make this more difficult. It's going to add more resources and probably drag out that change curve more than you'd like. You can absolutely overcome it, but it has to be intentional. You have to invest in it. And to Rob's point, it can't become a secondary thought. And it'll become a much heavier lift if you start too late, but absolutely still something that you can accomplish the right way.
Or maybe flipping that question on its head a little bit. Let's say you do have a defined process. You have great governance. You've got aligned goals. You see change on the customer side, maybe at a leadership level, where you had everything great and now you feel like it's turned on its head. And you have to almost do a reset.
Yeah, I mean, stakeholder turnover change happens. I think in many cases, depending on who the stakeholder is, you almost have to do an intentional pause, confirm alignment of where we were. This is why, this is where we stand, and understand if there's any changes in approach or focus from that leader. What does that mean to the project? And have a really intentional discussion around, does that mean we need to add this in? Do we have to change the project? Do we have to delay something? Make that change. Don't push forward and try and make it right after you go live, because again, you're kind of ripping the carpet out from the user at that point. They won't be prepared for the change that you put in front of them at the last minute.
Well, thank you all for your time. Really appreciate it, and have a good rest of your Wednesday hymns.
Thank you.